approach can achieve multi-layer rejuvenation from surface correction improvements in skin laxity and volume deficit. That's a mouthful. So I'm going to turn off
Vicky,
now.
I'm just going to say, yeah, because your voice, it's been cutting out slightly since you...
Oh, has it?
So,
I've got a bit of feedback. I can hear myself.
That might be it.
Hopefully it's all right when you're speaking.
Yeah.
That's the most important part.
Okay.
So I'm going to turn off my video now, but when we come to the Q&A, I'll be back, and we've got a questions tab where you can post your questions for Dev at the end of his presentation. So Dev, I'll hand over to you now and turn off my volume.
Okay, brilliant. Okay, so good morning, everyone, or perhaps good afternoon or evening, depending on where you're located. And welcome to this webinar titled Combination Techniques to Brighten, Tighten and Volumise. So as Vicky kindly gave with the introduction, my name is Dr. Dev Patel, and founder of Perfect Skin Academy and Perfect Skin Solutions. I've worked in many different environments, 9 years in the Royal Navy and 5 years in total in the NHS. And then for the last 6 years, been running my clinic full time. We were due to launch our academy this month, but sadly, because of the pandemic, things have been delayed a little bit. So, sorry. Yeah, okay. So today I'm speaking on behalf of InMode, and thanks very much then for inviting me to present this webinar. And I do KOL for a few other companies as well. So what are the objectives? This is perhaps a little optimistic with the time limits that we have, but hopefully by the end of this 25 minutes or so, you'll have some idea of the mechanisms of action of radiofrequency or RF and IPL, and understand the key features of MORPHEUS 8 and Lumecca, as well as know some of the indications and benefits of these technologies. So we should start by talking about radiofrequency. I do want to speak a little bit generically of this because it's important we understand what it is, or at least some of the basic physics of this technology. So it refers to a frequency range within the electromagnetic spectrum, and it's essentially an alternating current, similar to what comes out of your plug points around your house that supply your electrical devices, but that's running at around 50 hertz in frequency. And so when we introduce this RF energy, we have to think of it a little bit like electricity. The underlying behavior is the same. The fundamental principle is that if passage of energy meets resistance, it will create heat, and different tissues will give different resistance. It behaves differently, however, to the electricity coming out of your plug point, thankfully. So you're not going to get these deep electrical burns if it's applied with the sort of technology we're going to talk about today. The RF energy instead hits the skin and then very quickly turns 90 degrees and works on a superficial level, thereby not penetrating too deep, giving you a much safer way of introducing energy to create heat. And so it is an oscillating current of electricity, and it's this oscillation, these oscillations, that cause vibrations and collisions between charged molecules and ions, and that is what gives you this controlled heat. And that's the key thing, controlled heat, because safety is obviously so important. So the big advantage of RF is over laser, for example, is that it creates non-specific heating. It's not chromophore specific, i.e. color specific. And I've given away the big advantage there is that it can be used on any skin type. So why heat? Well, it's because we wish to induce or trigger a controlled wound healing response in the tissues. This is the magic we wish to create to correct otherwise permanent damage from aging or trauma, which is given scarring, for example. Now, if we take just skin laxity, that is a very common aesthetic concern. And, this is due to diminished biosynthesis of collagen, elastin, and abnormalities of the extracellular environment reduction in the concentration of hyaluronic acid, etc. And as you can see from this diagram, you know, this is what we're doing: tissue renewal, dermal remodeling. This is going to give you back a lot of those things that have depleted over time, thus improving the laxity. So let's move on to these exciting devices, MORPHEUS 8, and I'm going to mention FRACTORA as well, because people will have heard of that. The nice thing is that you can operate the MORPHEUS 8 off a number of versatile InMode platforms, and they're shown here. And I've got a couple of the platforms, and the nice thing is you can even use the MORPHEUS 8 off the laser platforms like the Triton and the Optimus as well. So there's a lot of versatility depending on what your needs are for your clinic, for your patient base, etc. It's just a bit more about RF very quickly, but I think it's important. There's two main types of RF: radiation RF, which is applied from a distance, there's no contact with the skin, and conductive RF, which is where the electrodes are in contact with the skin. And then you've got two types. You've got monopolar and bipolar, we commonly hear about. So monopolar, one electrode is touching the skin, that's the device that's touching the skin, and the other electrode may be held in the hand, or maybe in the form of a plate, perhaps on the back. Involve, you know, cold plate. I've had a machine like that years ago, and it's not very pleasant for the patient. There's jelly required, etc. And then you've got bipolar, where both electrodes are touching the skin, and therefore the area of current flow is limited, which I'll show you in a diagram shortly. So the nice thing is that with bipolar, you can control the penetration depth as well as the energy input, whereas with radiation and monopolar RF, the penetration depth into the body is not controlled, neither is the amount of electrical energy that is passing in various body areas. So let's go to this exciting stuff, MORPHEUS 8 FRACTORA. For someone who doesn't have these devices, if you are a medical professional thinking about these, then just focus mainly on the MORPHEUS 8, but it's important I talk about both because they're essentially the you know, brother and sister, if you like. So FRACTORA has been around for years, I think over a decade, if I'm not mistaken, and the MORPHEUS 8 has been around for well over a year now, and I fortunately have both. Had the FRACTORA for a long while, and then introduced the MORPHEUS 8 to my clinic when it was launched in the UK. And they are both microneedle assisted radiofrequency devices. So they are essentially using microneedles or pins to go into the skin to then deliver radiofrequency to the area you want it, rather than introducing the radiofrequency topically from the surface, which, as you may know, if you've got a topical device, it can be quite difficult to hit those target temperatures that you need to induce the controlled wound healing response. And then to maintain those temperatures uniformly can also be quite difficult. So it's obviously superior to be able to deliver the radiofrequency directly to the target where you need it. And that's where these devices come in. So as you can see at the bottom, you can hit a number of different depths from 0.5 millimeters, so surface, resurfacing really, to 1, 2, 3, and even 4 millimeters, giving you dermal and even subdermal activity and improvement, which we'll go on to now. So the MORPHEUS 8 is comes with two pin heads, both 24 pins. One is resurfacing, 0.5 millimeters, and the other one has pins which can be varied in depth depending on what you set on the machine, 1 to 4 millimeters. And you know, FRACTORA was similar in that way. There was a resurfacing tip, 0.6 mils, that had 60 pins, which I do like, and the 24 pin at fixed depth at 2.4. The one big reason I still use FRACTORA is scarring. You'll note that it comes as an uncoated pin, whereas the 1 to 4 mils on the MORPHEUS 8 are coated. And that uncoated pin allows you to deliver radiofrequency energy throughout the whole length of the pin. There's a diagram coming up which will show that better in a second. So here's some of the advantages. You've got this polymer coating, and if you look at the image at the bottom left, which looks like a bullet, you'll see, there's quite a few questions coming up, so I'm getting distracted. You'll see that the coating ends just shy of the tip. So radio frequency energy is not dissipated down the shaft until the insulation ends, and that's where you actually deliver the energy. So you can be very, very precise. The other key improvement with Morpheus 8 was that they automated it. So rather than the pins already be sticking out of the housing with a Fractora, so when you put it to the skin, the pins went in straight away. With a Morpheus 8, you can just place it on the patient, face, body, wherever, and they won't feel a thing. The pins are in the housing, and when you touch the pedal, the whole thing happens simultaneously. The pins are driven into the skin. When they're at the right depth, as you've programmed, the RF energy is introduced down the shaft of the pins, discharged, and then the pins are drawn back into the housing, all in a moment and all done by the machine. There's no coordination required for the user between placing the pins into the skin and then discharging the RF, which if you don't time right, you can cause arcing and cause superficial burns, which are fine. They're not serious. They're you know, it can actually give a good corrective effect, but ideally, of course, you don't want to do that. So Morpheus 8 has really, really helped us as practitioners and is much more comfortable as well. There's lots of other features in the machine. You can cycle, you can do multiple pulses with one shot. Again, you can just keep your foot on the pedal if you program it that way. You can also time the machine to the timing that you work at, so you don't have to keep pressing the pedal and get strain in your shin. So there's lots and lots of things, and that's what I mean by all the other clever stuff. Okay. So yes, you get a thermal effect down to 5 mils. You can work down to 4 millimeters, which is down to the adipose tissue in most areas. You don't get any effect on the epidermis, apart from a little bit of reddening in general, and so the downtime is much less. And the pins are specific to the patient, the head is specific to the patient, so there's no chance of cross-infection either. So here we are very briefly. You've got the negative electrodes on the actual head, and then the pins act as the positive electrodes. And so you've got the current flowing from each electrode, positive and negative, creating these multiple pathways of current, and therefore giving you this nice uniform effect throughout the tissues. We've been through that. So you're getting mechanical injury, just like you would with microneedling. Obviously not as many entry points, but still quite a lot. So that in itself is beneficial. And of course, then you've got the thermal effect, which we've talked about. So you get 3 zones of RF thermal injury. You've got this immediate zone of ablation. You've then got this coagulation zone, similar to the coagulation you can see in some deep chemical peels. And then you get this non-specific heating, which is one of the key advantages between this and laser, is this uniform controlled heating effect. Sorry, that's just gone. I didn't touch anything, I promise. Okay, should be back up. So you can see you can get this triple effect at various steps depending on where you introduce the energy, and that depends on the settings you put on the pins. What I should mention is, with regards to the fat, there's 2 things we're trying to do. We talked about target temperatures, and you want to hit at least 42 degrees with the dermis, and with fat it should be at least 45. And we're definitely doing that with Morpheus 8. We're doing 2 things. We want to induce apoptosis in those fat cells, and we also, very key, is contracting or working on the fibroceptal network. 80% of the fat cells are situated within this network, and so if you shrink down this network, then you effectively shrink down the fat cells and contour the fatty areas. And that's a key thing that's giving you this, not just contouring the fat, but also contraction or tightening effect you see within the skin itself. And this is just saying it again. So with the resurfacing tip, you can really work on surface issues such as vascular problems, pigmentation to a degree, but we're going to come on to something even better in a second. Skin tightening, dermal remodeling, improvements in texture, pore, which is again more surface stuff, and then, as I just mentioned, improvements with fatty areas as well. This is just going over the same thing, so I'll just skip that. So, you know, this is the patient you've got coming in front of you. I mean, I think there's a value for Morpheus 8 for anyone over the age of 40 or 30, sorry, because we're losing collagen and elastin from our sort of mid to late 20s, really. But when you get this sort of global, moderate to severe photo damage and chrono damage, and you've got these multiple issues at varying depths, epidermal, dermal, and subdermal, then really, you know, my favourite has to be the Morpheus 8 for trying to tackle such a global issue and still delivering improvements. Just going to play you a little video if it plays. I don't know if it will. No, there's probably a tab where I can play this, but it's fine. It was just going to show you the actual device in action, but you can visit Perfect Skin Solutions YouTube channel and the videos on there. And so let me just show you some before and afters. Bear in mind, you know, the device has been out for just over a year, so some of the patients I'm going to show you haven't even come to their full effect yet, including this lady. Who'd wanted just a treatment done on the jawline and the neck, but already you can see some nice improvements. This lady literally is a week after her second treatment, so we're not expecting to see any significant improvements in laxity, etc. But if you see the if you see the area here, you can quite clearly visualize the improvements that she's already experiencing at a more superficial level. Some body treatments. Sorry, I skipped through that one. You know, this is a common area patients will point to, won't they? And you know, we get fat hypertrophy to a degree in the lower face and the neck because the fat cells behave differently to other areas of the face. And so this is quite a stubborn area to deal with. It's quite nice to deal with the laxity as well as the unwanted fat in this area. This is one of our body patients. She'd actually had a number of modalities tried on her over the years, not really happy with the excess skin. And, you know, again, this was literally a couple of weeks after her third treatment. So she has yet, and even now will be in a better place than this picture shows. But you can see improvements in the skin laxity, but also in the dimpling, that almost a cellulite type effect on the skin. You can see that that's really smoothed out, and it does indeed help with cellulite. This is just her other arm. This lady, young, has had a couple of children and was bothered by this laxity. Again, you know, we've lost her to follow up, but when she came for her second treatment, she actually said, oh, my tummy's also flattened out a bit, because of course it had had some effect on the fat as well. Clearly this was done at 4 millimeters, although we do some superficial work as well. So this is another neck result. And again, I don't know the timing because this is from a colleague in the States. This is FRACTORA, but again, you know, the principle is the same. The principle is the same. I think overall the Morpheus 8 is a lot better in terms of usability and patient experience. And this lady didn't have the uncoated pin, so nothing you wouldn't be able to deliver with Morpheus 8. But you can see 13 months apart from her pre-treatment photo and no other intervention aside from this. And you can see the volume that she's got back. You can see the improvements in the skin laxity and even in the surface pigmentation, vascularity, etc. And this lady, you saw her earlier, again, just 2 treatments for FRACTORA. She wanted dermal fillers, but actually I suggested, you know, she should have this done instead. And you can see, you know, a really nice global improvement. Yes, she could have more treatments, and she probably will. So what I love about this technology is that it's colorblind. You can use it on any skin type. It's very safe. It's quick. very minimal downtime, and for the results that people get, it's fantastic. I say almost every patient, you do need to make sure you select someone who has the right mindset, that it's going to be a very gradual improvement. And sometimes people don't even see it within a few months, and they just have to wait a bit longer, but it is happening underneath. The technology works, and it works very well. And I can sleep at night knowing that it's very unlikely to cause any problems. And this is why we do it, because you end up with happy patients, and happy patients makes a happy doctor. So let's go on to this, and you know that one of the 3 main subliminal cues that people pick off that indicate aging, this is from a very good twin-based study, is pigmentation. Of course, it's not just about pigmentation, it's discoloration in general, so we're talking about the reds as well. But it's quite obvious which is the healthiest banana here and which is the unhealthiest, most damaged banana. May not be the oldest, because you know, it depends on how many sunbeds and everything else you've been doing in life, but certainly when we talk about skin health, it's quite obvious pigmentation is a key sign of that. So let's talk about IPL. IPL is not laser. It is, you know, laser is one single wavelength of light of varying color, whereas IPL is, you know, you might see it as a white light, but actually it's made up of lots of different colors. It's a spectrum of different wavelengths. And, you know, IPL has, over the years, got a bad name in the industry because of its misuse, particularly for hair removal. And there's a lot of bad devices out there. But actually, for what we're talking about, photorejuvenation, treating discoloration, if you use the right technology, it's actually incredible, quite incredible. So hopefully you're familiar with this diagram. I haven't got too much time to spend on it, but essentially what we're doing with light like IPL or laser is we're using the theory of selective photothermolysis to treat our target, whatever it may be, the redness, the brown. If it is hair removal, then we're tackling the pigment in the hair. So we're searching out the color, and we're using different colors, or wavelengths of colors, to target those individual colors. And I'll show you a graph that explains that a little bit more in a minute. But this is the IPL spectrum. So some of you may be familiar with this, but just for those who are beginners perhaps, there's various things. The main things we need to think of is the water curve. You can see the water curve, and that's our tissues. Our tissues are mainly made up of water. So if we want a lot of absorption by the water, then we're trying to induce damage. For example, ablative lasers, like CO2 lasers, and that's why they're in the very high frequencies. But for what we're talking about here, we don't want that. We don't want the tissues to absorb, you know, non-specifically absorb all this energy, because we're going to just cause blind damage to the tissues. We're trying to target these colors, the browns and the reds. But the browns, we have to think about it. Look, I'm Fitzpatrick 4. I may want to tackle my pigmentation, but I don't want to start hitting my inherent pigmentation. So you've got to think of safety. And then with the reds, yes, you want to hit the reds, but you've got to think about where you've got the peaks, where you're going to get most absorption, but balance that with the curve for melanin as well. So there's lots of factors we have to figure in here. And as I said, you know, IPL isn't laser, and it shouldn't be marketed as laser, but for this sort of thing, it's fantastic. It generally works a bit more superficially, and that various companies, you know, will produce their different devices. What I love about Lumeka, which is the InMode device, the IPL device, is specific bits of technology that they've incorporated into this patented device that deliver quite a unique form of IPL. So some of its advantages, this is giving, I mean, the more you look into the Lumeka, the more amazing it actually is, but we don't have time for that, is that you've got a large spot size. This is the advantage of IPL generally. The Lumeka has got 2 filters, the 515, so everything below that is cut out, and 580, everything below is cut out. So for our skin types 1 and 2, we tend to use the 515, and for 3 and 4, and with 4s, we've got a specific protocol, and we may not treat all skin type 4s, but we can use the 580, and we've had some phenomenal results using that in those skin types for pigmentation. So here you can see the blue line is standard IPL, and one of the advantages, if I kind of skipped through it very quickly, is this low pressure xenon lamp. And what that allows you to do is there's a higher peak delivered in the lower frequencies, in that sort of sweet spot where between the 500, 600, and then it drops off very quickly. Whereas with most standard IPLs, it's a bit more gradual. You've got some of those higher wavelength energies peaking there, you can see. Whereas with the Lumecca, nice high peak, quick drop down, and that's the energy you want. So you're getting more useful energy to that patient. So you can still be on relatively low affluences, but more of that is hitting the target that you're trying to target. And so you get less downtime and a safer device, but you can, people hearing it? Yeah, okay. But at the same time, you're being safe and you're getting the clinical results that you want. Sorry, I got distracted. Someone can't hear, but hopefully it's just the one person. And yeah, so I've just mentioned that. So 65% of your energy is in this 520 to 650 with the 515 filter. That is, you're getting slightly less energy delivered with the 580 filter, but you do need to be a bit more wary of people in the higher Fitzpatricks. Obviously 5 and 6 we wouldn't be treating, but for them I particularly do want to use the resurfacing head from the MORPHEUS 8 or the FRACTORA, because that will give quite a lot of improvement, as you saw in that lady earlier. Okay, 4 minutes, about 4 or 5 minutes left, and so yeah, I've already been through this, and I've been through that. So let's get through to the more interesting stuff. So for vascular lesions, we tend to do between 2 and 5 sessions, but I'm going to show you some actual case studies in a minute, and most of the slides do say how many treatments they've had. That will give you a real idea. And what I've found is that with this, this is my 3rd IPL system that I've had in the clinic, is that with just 1 or 2 visits, you can get the results that may have taken a course of 6 in the past, or results I may never have achieved beforehand. And with people's ever busier lives, the less visits they can make to you, the better. And of course, the one thing people hate is that they have to avoid the sun before and after, and that impacts on their social life and lifestyle. So less visits is better. And then the pigmented protocol. But of course, most people have a bit of both. So, you've got to take that with a pinch of salt. So this is actually one of our early patients, so quite low fluence treatment. We could have maybe gone stronger, but still a really nice improvement of pigmentation, which you can't see as well, but also the vascular areas. And another result, this is just 1 treatment. Now, it's important to note that what patients have reported and what we've observed is that aside from the improvements in discoloration, you do get this a little bit of like collagen stimulation. There is definitely an improvement to the quality and appearance and youthfulness of the skin. And patients report it usually within 3 to 4 weeks. Most of them, 9 out of 10, will say, "Oh, I've already noticed, it's amazing. I've had people notice my skin." And that's lovely to hear, because when you go on about something and then maybe they don't notice things like that, it can be a bit disheartening for them. But most of our patients do pick up on that quite quickly. This was just, again, when we were just trialing the machine. Looks a bit odd. She was only willing to pay 50% of the price, so she only got 1 arm treated. No, I'm just kidding. But obviously, 1 arm's been treated, 1 arm hasn't. You can see she's still healing. She's got some crusting there. But this is only, I think, 1 session, or perhaps 2. Yeah, as I've written there, 2 sessions. But now, obviously, we have treated the other arm, and it was just to give us an idea of what this could do, and quite impressive. Again, a chest, this is just 1 single session, and it wasn't that strong either. It wasn't on the max setting, but really wonderful results with pigmentation and superficial vascular lesions as well. And you can just see that general improvement in quality of the skin. Another one, just one session, really, really impressive result from my colleague, Dr. Ross. Again, one treatment, really, really impressive result. Again, one session, you can see 72 hours later where it looks worse, so you have to warn patients of that, and then 4 weeks later you can see really impressive final result. Again, one treatment, almost complete clearance of that visible pigmentation. And again, that's important to note. I should go back to that you can see the pigment almost comes out a little bit. And again, you have to warn patients about that. Otherwise, they'll think you've made them worse. Hands, again, not a great photo, but really, really good results on the hands. So we generally, offer options for face. We do the neck as part of that, hands and chest area, particularly for ladies. If you don't have harmony from here to here, then it doesn't look right. Again, really good result on chests. And this lady, this isn't the end point because we only started treating her at the beginning of this year, but she's had some MORPHEUS and Lumecca, and you can see some nice improvements there already on pigmentation and vascularity. But what I wanted to just show you is the upper eyelid. You can't press on the eyeball, so you can only treat down to about the eyebrow, pulling up the skin, and yet still you can see that there's been quite a nice lift to the eyelid from the tightening that we've delivered higher up. And I just want to show you this lady again because this is the title of the talk: tightening, brightening, and volumizing. And that this lady shows all three. There is volume because of the dermal thickness increasing. She's definitely been tightened, and she has had texture improvement. She's half Indian, so I don't think we had Lumecca when we did this on her. But even if we'd had, she's had a fantastic result. But I think the 580 Lumecca could just improve some of the pigmentation higher up, and she may very well have that. Okay, so that brings me to the end of the talk. Thanks very much for joining us, particularly because there's been so many webinars over the last few weeks. And I did have to scoot through quite a few bits. I've still overrun by about 2 minutes. We wanted to allow about 10 minutes for questions. My contact details are there. So if I ran through anything very quickly for you and you would like to know a bit more, or just on protocols or anything like that, if you've bought the machine, or even as a patient, because I know this is open to the public, then feel free to contact me on one of those platforms and I'll be happy to get back to you. So right, we'll take questions. How do we do this? Vicky? I'm hoping Vicky will appear and something magical will happen. But in the meantime, let me just let me scoot through it. Wow, we've had a phenomenal number of questions, and apologies in advance to the ones we won't be able to answer. Is MORPHEUS only for medics? It's best to speak to InMode, contact InMode, and they'll be able to contact you. But to my knowledge, yes, MORPHEUS 8 is only open to medical professionals, and some of their devices definitely are only open to medical professionals. Some are only open to doctors, but MORPHEUS 8, I know nurses doing it and I know doctors doing it, but I don't know anyone else doing it, and I think that's appropriate. Will IPL increase skin cancer? No, because the UV, the ultraviolet, it's ultraviolet radiation that increases your risk of skin cancer, and that's filtered out. That's not part of it, so you don't need to worry about that. In fact, in theory, it probably improves your skin cancer risk because you are actually giving photorejuvenation. You're actually tackling sun damage on the chest. So if anything, it probably does the opposite, but it certainly doesn't increase your risk, no.
Hi, Dev. Thank you so much. You're answering your own questions like a pro. I couldn't turn my camera and my microphone back on. Apologies for that.
No problem, no problem.
So I'm not sure what we got down to on the questions, but I think a few people were asking whether these treatments are for medics only, or whether non-medical practitioners, aesthetic therapists, I guess, could do them as well. So can you tell me a bit about that?
I did tackle that just before you came, but essentially I had to give the easy answer, which is contact InMode if you're interested, because I don't want to say anything that goes against their selling policy. But from what I understand, it's the people who I know doing it are medical professionals. But I think as an aesthetic therapist, if you've got a beauty background, you may be able to use it, but I don't know if it's under the umbrella of a nurse or a doctor, or whether you can do it standalone. So I'd rather just do that before I get an angry message.
Okay, so we've got another question here, that what is the best treatment for hyperpigmentation in Black and African skin?
Yeah, very good question. Because certainly Lumecca is not for that, for the darker skin types. I would, in my clinic, we use so if there's we can use the superficial, the resurfacing heads for the MORPHEUS 8 or the FRACTORA, so 0.5, 0.6 mils. You're just going very superficially, but because you're using radio frequency, which is colorblind, as I said in my presentation, it will give you some nice improvements to the surface without giving you those risks. It doesn't mean nothing's completely risk-free in life, but it's very unlikely that you're going to cause any permanent issues, even if there is a little bit of transient pigmentation. But of course, there are some cosmeceutical programs out there now, which we're about to launch one actually in a few months' time, which combine an in-clinic treatment with then something you give the patient to take away with them at home and use. And the range we're going to be bringing in, the founder, the scientist who's behind it, has specifically designed different protocols and products based on skin type, and there is one for the Fitzpatrick 5 and 6 types. So I think something that's specifically geared for that skin should be used. I tend to veer away from laser and all these things because they're potentially just going to be quite risky in those darker skin types. There are exceptions, of course. So I'd say, yeah, if someone's got this technology, then great. Otherwise, those sorts of cosmeceutical but medical grade programs are probably the safest approach. Definitely not buying anything offline, because we've in the past 3 months seen 3 African patients who have caused the most horrific and no doubt permanent hyperpigmentation and scarring because of things they bought off the internet.
And I guess with all of these things, obviously from your presentation, you're showing different modalities that you can use to get really impressive results across a different range of indications. And I suppose with anything, being a medical practitioner, aesthetic practitioner, you're looking at what the different tools are in your box and what's most appropriate for each individual patient. When you look at buying capital equipment or look at getting a device-based treatment into your clinic, what are your main considerations? What are the most kind of important things for you? Because obviously I think that's one of the biggest outlays a clinic will make, but it can, as we can see, you can get amazing results and you can treat a whole load of things. So what would be your kind of key points when you're looking for something?
Okay, I'm glad you asked that, because I know there's plenty of medical professionals watching, and I get asked that quite often when I go to conferences, is what machine should I buy? I've been asked that, what machine should I buy? And that's the wrong way to think about it. So you have to, first of all, sit down and go through your own business plan. Are you planning to be a sole practitioner in 5 years? So is it just going to be you doing everything? Are you planning on building up like we have? I've got a team of 13 now with 5 or 6 therapists. So what's your aim going to be? Do you want passive income, people earning money for you when you're, on holiday somewhere? So that is going to influence your decision. So you need to have a good business plan. If you haven't got that mindset, then you need to get a business consultant on board to advise you of that. Then you need to look at your patient base and see, am I in an area which has got lots of different ethnicities? I've got lots of people with Fitzpatrick 4, 5, 6 skin types, because that's going to influence the machines you buy. And then ask yourself, what do I miss? What do I not have? When you're seeing your patients, if you have a clinic of 10 people, when at the end of that clinic, how many people did I have to say, oh yeah, sorry, I can't do anything for that problem. I can't do anything for that problem. So have an understanding of where you lack something, where you're missing something that you could really do it. And then go from the problem, say, oh, I'm really not able to help with laxity. I'm really not able to help with vascular lesions. And then work backwards and think, okay, so now what technology do I need that's best for this problem in those skin types? And then once you've got that decision sorted, then you start looking at devices.
Yeah.
And for me, my early devices had to be platforms, because if you spend 80, 90, 100,000 plus on one single thing that does one type of laser or one type of whatever, you may be very limited. And, you know, I'm speaking on behalf of InMode, but I have to say, you know, companies will say what they need to say, okay, overall, okay, and although they are a very ethical company, I have to say, but you know, they will say, and they'll say, oh, you only got to treat this many patients to get your money back. But in reality, it can be sometimes difficult getting those in. So look at your own patient base, because they're the ones that you'll instantly have available to treat. So before you market or advertise. And so platforms, I think, are key. And within InMode, that is what I love. They've got literally with one platform, my first platform, I could deliver body type, face type, Accutite, FRACTORA, MORPHEUS 8, Voltiva, which is for female wellness. And then the next platform I bought, I've got laser hair removal, and I can do all those RF technologies off that second machine because we've got so busy with it now. So I think versatility is one of the key things. And then you've got to do the maths. Speak to your accountant, speak to someone who can do the maths, and make sure you're not going to enter into anything that you regret.
That's a great answer. Thank you very much. So we've got some more questions here. So can IPL treat post-inflammatory hyperpigmentation? And they put in brackets from shaving and scarring.
Yeah, so the one thing with PIH for short is that you need to wait. So you can obviously use various lightening creams, tyrosine inhibitors, etc. But just wait and be patient. You don't want to create more inflammation, because that's why it came about in the first place.
Yeah.
So wait, I would say wait at least 12 weeks. See what happens. Most PIH from things like this should go. Even PIH from acne, etc., should eventually fade. Then ultimately, when you know you've hit a plateau and that's what the person's left with, then yes, you could consider doing it. But in the experience of many, for certain types of PIH, for example, from acne, very few things will actually give you long-term improvements. So it may just come back again. And I'm you know, trialing things with other products in terms of injecting into these lesions to see if I can get a more long-term benefit. So the answer is yes, but be patient and warn your patient that it might actually return. There's no quick fix solution for it.
Fantastic. So we're running out of time, but there is one last question. Will it also work for vitiligo?
No.
Well, there we go. That was the short answer.
You can even do one more. We've got 2 minutes according to my clock. But
okay. Let's have a little look down to see if well, I was going to ask you about combination treatments. So you've talked about the platform, but I'm assuming you would do these treatments as well in combination with other treatments at the clinic. And what about if you were doing something like fillers? Would you do this first and then look at doing fillers?
Because I get asked that a lot. In an ideal world, I say if every patient over 30, certainly over 40, could have MORPHEUS 8, I'd be onto a winner. And then after that, dermal fillers, because as you saw, it gives a volumizing effect. Yeah. So I actually have to then do less dermal filler, and I can be a bit more selective. Still a global approach, but you can basically be more efficient with it. And you know, that's a nice way. If they've already had dermal filler, they can still have MORPHEUS 8.
Yes,
they can still have it. But I prefer to, depending on what product they've had, I may ask them to wait a certain number of months, or may not, again, depending on what I've used. But in an ideal world, if they've had nothing, energy first, and then the dermal filler.
Okay, fantastic. Dev, thank you so much. It was a really interesting presentation. If anyone was having problems with their sound, you will be able to see the video on our website afterwards, and it was streamed onto our Facebook, Aesthetic Medicine Live Facebook as well. So do please get in touch if you missed anything, and we'll be happy to share it with you. Sorry if anyone was having any issues. But thank you so much, Dev. That was really great, and I'll hopefully see you actually in person soon.
Yeah. Then thanks, Vicky. Thanks very much.
Thank you.
Thanks, Vicky. Bye. Bye.
Bye.